As I have already announced, today's topic is salivary biomarkers in oral cancer and evidence review. And I would like to proceed to the brief introduction because most of you may not be knowing what I am before I'm talking to you today. So I was a medical doctor and a professor in Tagore Medical College before I became myself as a reshaped my career as a medical entrepreneur. Right now, I am the founder and CEO of Kairos Kinetic, which is a biotech startup, which is 1 year old. And I'm also, as I mentioned, CEO of Global Biomedical Research Foundation, founded by Dr. Kannan, which is a nonprofit. I'm also associated with 3 medical colleges, Panimalar Medical College, as well as ESI Medical College, Hyderabad, and Savitha Dental College and Hospital as distinguished faculty. So in this particular session, my objective is to introduce to you the global and national literature with evidence on salivary biomarkers for oral cancer, and also equally introduce to you some innovation updates in this particular domain. If you look at the burden of oral cancer, the WHO in 2020 identified the top cancer in India is oral cancer. And in that sense, it is killing 5 Indians every hour, every day. When I checked latest in 2022, it has been scaled down to the second most common cancer in India, but still it is alarming. And if you look at the media reporting, all this projected media prints show that oral cancer is epidemic and it is costing 3.2 billion in the next 10 years, and of which tobacco is the culprit. And recent Lancet study is a wake-up call for smokers as well as policymakers to make some urgent actionable policies, as well as cancer cases and deaths are steadily increasing in the country. If you look at the background, what is the reason such alarming reports are coming out in the media? 90% of oral cancers originate from squamous cells. That's why oral squamous cell carcinoma is the major oral cancer. And the prognosis is still poor. Why? Because it is of late diagnosis. Most commonly, I have seen some of my dentist colleagues joining the session. They will agree with me that we are seeing cases. Me being a public health epidemiology background researchers, I have seen in my camps, which I'll show you later, and they are seeing in clinics, sitting in medical college hospitals and their private clinics, people are arriving to them in stage 3 or 4. And if you look at what is the gold standard for this diagnosis, generally it is preceded by a clinical examination followed by a biopsy. By that stage, the cancer is already established. That's the reason you are seeing so many deaths. And if you look at the current methods of diagnosis, on the left half side, you can see a clinical examination or a toluidine blue staining, which is not a routine method of diagnosis, only for research purposes. And also autofluorescence methods such as Valescope and Visilight, which are very expensive and situated only in tertiary care settings. And because of this reason, you can see that the lack of point of care device diagnostics are leading to the late diagnosis, because of which, again, an interconnected increased costs in healthcare costs leading to premature deaths. So this is the major crux of the problem. And this has been identified by doctors in India who are practitioners and writing in the media that India is seeing 1 million deaths due to oral cancer every year. And this is way back in 2019. And India ranks second in productivity losses due to cancer-related deaths. But highlighted here are this many billion loss is from lip and oral cancers, which is alarming. That is what you have to understand when we say premature deaths, it is leading to this kind of economy losses at a country level. And if I just quote it there and leave you, you might not perceive the magnanimity of the problem. And if you look at the burden of oral cancer on the 10 most populous countries in a decade, this particular study will help you to understand. In India, nothing has changed over a decade, except that the change in absolute numbers has been almost 170%. So we might generally believe over a decade, the health system and health awareness and lifestyle and quality of life have improved, but things have not improved regarding oral cancer. Change in absolute number is 170% increase in oral cancer cases, very alarming. And if you look at the gender specific segregated data, this particular highlighted loop tells you even now it is predominantly male-oriented cancer in India compared to other countries. Still, it is 3:1 or almost 4:1, where males are getting more affected because of oral cancer. And in this particular study, they concluded that the increasing incidence, mortality, and DALI of oral cancer, it poses a major public health challenge, and control of SLT, that is smokeless tobacco use in India, especially has to be the critical strategy to address this problem. So with this background, you might be wondering, like, how did I end up as an entrepreneur? Why did not I continue with the same kind of profile as a doctor or teaching in medical school and doing my own research? I'll just lead you into this background. I was doing that only. I was doing a lot of health camps at construction sites. You can see this is a snapshot. We used to do on an average 4 to 5 camps per month. And we used to do all this variety of services with migrants and transgenders. But the screening penetration for such services is less than 5%. This is the national data. I'm just projecting my story, but if you look at the nation, this screening of oral cancer is less than 5%. That is 0.2% of population are covered by such services. And if you look at the burden of tobacco users in India, it is 277 million. So you can just translate that. And these are the pictures from my own health screening camps. So much of cancer is actually in their mouths, which is happening right now when they came in contact with us. When we ask them to come to our hospital, majority of them generally don't come, because for them, earning their livelihood is more important than losing their daily wage and come and sit in the clinic, get a biopsy, get a confirmation. So what is that project outcome? At that point, before COVID happened, we almost covered 30 construction sites and almost covered 3,100 migrants. And specifically in this population, we identified 44.5% of people with suspicious cancers. This is what triggered me to actually proceed with this entrepreneurial kind of decision. So what is the current trend? Why salivary biomarkers? If you look at the current trends, employing saliva in liquid biopsy for this oral squamous cell carcinoma management. Why? Because saliva is the mirror of the body. All of us know, like other biological fluids, saliva has most potential significance because it reflects the physiological and pathological change in the local and distant sites. And when we are talking of oral cancer, which is developing in the oral cavity, in the cheeks, in the tongue, in the floor of the mouth, in the roof of the mouth, near the throat areas, this is the most ideal fluid which is capturing those changes on a daily basis. And it represents an easier, quicker, and accessible screening tool to collect larger volumes and also repeat analysis at convenience, being a non-invasive sample collection. And all of us are moving towards the Sustainable Development Goal achievement by 2030. And this kind of innovation and non-invasive tool development directly fits into this SDG Goal 3, which talks about ensuring healthy lives and promoting well-being for all at all ages. Because remember, they are coming at stage 3 and stage 4. That is not promoting well-being for everyone. So if you look at the definition for a biomarker, it is defined as a biological molecule found in blood or other body fluids or tissues, and it has a sign of a normal or abnormal process of a condition or a disease. This is the definition by National Cancer Institute. And if you look at the saliva, as I have already told, it contains 99% water and rest are inorganic and organic substance. And that's the beauty of this biological fluid. Within this, you will be able to detect hundreds and thousands of key components which are indicating of a pathological disease or a biological process, like whether you are having a normal or abnormal heart rate, blood pressure, or temperature, and also a person's response to a particular treatment or a medicine, or also a psychological condition. All of you may remember the cortisol, which is a stress hormone, can be detected in your saliva and it can respond like what is your mood. So in this way, the biomarkers are used in many scientific fields and in different ways. And currently, as all of us know, during this presentation, it has a very futuristic medicinal potential in this world. And when I say like futuristic, you may be thinking it arrived yesterday or day before yesterday. Not the case. In 2003, the University of California, Los Angeles, they have, in a collaborative approach, developed an integrated point of care multiplexing saliva-based platform for oral cancer detection. So way back in 2003, this was the first point of time where they thought about this concept. So we are talking 20 years later, where we are seeing the potential of it still to be realized. And we are talking about what are the characteristics of an ideal biomarker. As most of us in scientific world know, any ideal biomarker, and I'm using the word ideal, it should have great sensitivity, specificity, accuracy, and predictive values, which are to be high. And it is to be safe and easy to measure, cost efficient, because we are talking about public health utility. And it should be modifiable with treatment, in the sense, once you apply the treatment intervention, you should see its modification either in the decreased level or increased level for the positive patient outcomes. And it should be consistent across gender and ethnic group, which is highly questionable. Because in a country like India, certain ethnic groups have a varied tobacco uses and other cultural factors which influence the expression of cancer factors. So this last point, we have to take it with a regional and other cultural context. And if you look at the right half, what are the uses of these biomarkers? It can start from drug development. So it has a role in clinical trials and in screening of diseases, especially cancers, risk assessment, diagnosis, monitoring the therapy, as well as to select additional therapies. All of us are aware what's happening in the biotech hub of Bangalore. Once a cancer is detected, they are identifying what is the target cancer gene or therapeutic gene so that you can cocktail the therapy and address it. Such precision medicine is the talk of today, and we are talking about such role the biomarkers can play in today's context. So when we talk about biomarkers, it's not so easy. We just land up there. We need to do with biomarker discovery. And later we have to confirm that particular biomarker is directly related to that particular expression of the cancer, and later proceed to the assay development. Once you develop the assay, we need to validate whether that assay is actually identifying the biomarker in the expected population as expected in its performance, thereby going towards the clinical utility. Clinically, in the clinical care, are we having a utility or beyond the lab controlled environment in real world, whether this particular assay has a utility, value, and public health efficiency? We have to perform these kind of robust clinical trials, based on which we will seek regulatory approvals, and thereupon only it will actually translate into a clinical tool for the benefit of the society. So this entire life cycle has to happen, since we use a word called biomarker. So once we identified there are biomarkers, they have utility, how are we going to identify those biomarkers? There are varieties of technologies by which we can identify them, starting with genomics, transcriptomics, proteomics, metabolomics, and other technologies, and imaging. Of all these technologies, right now, as entrepreneurs, we are actually using this nanobiotechnology. But there are many scientists, based on their interest and their exploration potential, they are playing around with all these options, which are right now available from anywhere in the world. Once you identify the biomarker, as I have already told you, there are multiple phases the biomarker has to go through. I'm just introducing to you so that you know there is this world. The identification of biomarkers should also proceed in a systematic manner as listed here by the National Cancer Institute's Early Detection Research Network. In phase 1, the identified biomarkers are prioritized, whether they are diagnostic, prognostics, or therapeutic, right? For diagnostic means you will test whether it is identifying the disease. Prognostic means whether it is predicting whether the disease is improving with intervention or not. So these kind of differentiating and discriminating roles the biomarkers will be playing. In phase 2, it involves establishing an assay with clear intended clinical use, which I have explained in my previous slide. And in phase 3, we will go towards evaluating the sensitivity and specificity. Sensitivity is identifying the correct person, the person who is actually having a particular specific disease or a condition, whereas specificity is correctly identifying the person without having the disease. So these are the terminologies, and as medical people and biotech people, we will be evaluating whether that particular assay is going to identify the people based on these biomarkers. And phase 4 evaluates these two parameters on a prospective cohort, that is futuristically. And phase 5 evaluates the overall benefits, as I said, cost benefit ratios, cost effective analysis, population health benefits. All these things will be involved in phase 5. Then only things will be actually giving us a complete picture. Is it so easy then to go ahead with this life cycle? Definitely not. Challenges are involved. And as I said, I'm repeating this, these have to be validated in clinical trials beyond the lab controlled environment in real world setting. These biomarkers have to be accurate, reliable, sensitive, specific, have to demonstrate a reasonable relationship to the disease which we are exploring, and have to demonstrate enough evidence of the predictive ability with this biomarker. Unless all these criteria are fulfilled to satisfaction, that biomarker will not have a clinical utility. So with this background about what are biomarkers and salivary biomarkers, let us look into the evidence about what the literature is saying. And you can see this particular study which came out in 2019, which is a very good literature for people like us working in this area. Salivary biomarkers of oral squamous cell carcinoma diagnosis and follow-up, current status and perspectives. They have identified after a very good review, it has several promising clinical uses, both in management, as it is painless, because saliva sample collection is painless. Patients will cooperate. They will understand how it is going to help. Unlike blood sample, it is accessible easily. Even we can collect from homes and get it transported to labs. Patient need not come. And it is low cost and represents a very helpful resource for diagnostics and prognostic biomarker detection. This is a summary of them. Even if standardized protocols for isolation of biomarkers, characterization, and evaluation are needed, this is the challenge, right? Recent data suggests they can be successfully included in future clinical procedures. So this shows a very promising outlook towards the salivary biomarkers inclusion into the future of oral cancer diagnosis as well as prognosis. And they have listed in their study starting from 2002 to almost 2017 and 20, all the variety of studies that have been undertaken globally and what type of biomarkers they are. For in this case, I have just showcased a couple of studies from Duz et al. In 2016. They have identified microRNA 139.5p as a salivary biomarker for tongue squamous cell carcinoma, and this is a diagnostic marker. Whereas the other author, Greither et al. In 2017, they have identified same microRNA group of biomarkers, microRNA 93 and microRNA 200A for follow-up, that is prognosis. So you need to understand the complexity of the world of the biomarkers, and that is how the science is emerging, and these are the current trends emerging and evolving on a real-time basis. And they also identified what are the pros and cons involved with these biomarkers. And for example, microRNA, the last one. they have identified that one of the disadvantages is it includes expensive detection and analysis, because if you want to detect a microRNA group of biomarkers, it involves expensive detection and analysis because you have to do the gold standard with real-time quality PCR. And these kind of technologies are not widely available. So if a researcher like us in third world wants to undertake this research, we have to be prepared that these are costly things. We may be facing a lot of challenges, funding crisis. In spite of all that, we have to go ahead and do this. Means we need to be prepared for that kind of roadmap. The other evidence which came out in 2021 is salivary cytokines as biomarker of oral cancer. And this is one more interesting study because cytokines have been widely studied in oral cancer, and they also reported potential diagnostic markers for oral cancers as well as oral potentially malignant disorders. The second, OPMD, is a group of conditions which are precursors for transition to oral cancer. And these authors identified that despite these cytokines as highly variable among studies, variety of cytokines have been expressed in variable conditions among different studies. They suggested that these can be successfully translated to clinical practice. So my understanding after a lot of literature review is every study is identifying its own potential and accompanying challenges, but the outlook is positive because there is so much of promise in these technologies and emerging trends. People are hoping against hope that these have a utility in the clinical practice, but mind you, it is a long road. And in this another study from India, the diagnostic accuracy of salivary biomarkers in detecting early oral squamous cell carcinoma, which is highly important in a country like India, which came out in 2022. These authors have listed a bunch of biomarkers starting from mRNA to microRNA. And as I have underlined, in their study, they have found out these two having high potential. How? This is their conclusion. They found that mRNA and microRNA had high sensitivity and specificity, almost 90%, and pooled positive likelihood ratio of 9.77 for microRNA. Again, repetitively, you can see microRNA is emerging as one of the most potential salivary biomarker for oral cancer detection. And in this, they found like it's almost 9.77 folds higher chance of a positive test result. Suppose someone has, this means it is high likely that that person is going to have that cancer compared to the other one who is having a negative result. So the overall area under curve in their study for both mRNA and microRNA is highest, highlighting that these are the most potential biomarkers overall. This is from an Indian author study. And if you look at another Korean study, which have done the salivary biomarkers meta review kind of thing, they also have classified variety of cancer biomarkers based on the disease state, whether you can predict the disease or detect the disease or diagnose the disease or prognosis. Once it has arrived as a cancer, how long or how many more relapses or remissions can happen, that kind of prognosis based on the disease state or based on the biomolecules like DNA markers, RNA markers, protein markers, or other criteria by imaging or pathology or in silico. Varieties of classifications have been attempted by these authors, which is very easy for researchers. So we can actually decide what kind of markers we want to explore, or a combination also, like in our case, we are trying to do a combination of markers. So they also based on carcinogenesis related factors, because all of us know when we say tobacco chewing is causing oral cancer, how did we know that? Because tobacco chewing product has 7,000 harmful chemicals, of which 70 are known to be carcinogen. So out of 7,000, 70 have been identified to induce cancer changes in the users. So similarly, based on that kind of inducement factor, whether angiogenesis, that new blood cells will be formed in that local area, or inflammation, as we know, happens in that area, which triggers again a cancerous cell growth. metastasis. From that local primary area, the cancer cell can migrate to new areas and spread like anything. Oxidative stress, all of us know oxidative stress also can induce carcinogens. So all these varieties of steps involved in carcinogenesis have their own biomarkers or signatures. So they have actually classified this also in their particular study. And based on biomolecules, this I have listed earlier, genomic markers, transcriptomes or protein markers have also been listed here. And as you can see, microRNAs have come under this salivary transcriptome category. So conclusion in this Korean authored study is it has a bright, promising future because it's non-invasive approach. However, the current challenges are standardizing the sample collection, improving sample processing and storage, and reducing the wide variability in cancerous and non-cancerous individuals. That's why all these standardization protocols, designing the protocols itself becomes a very important step when we are undertaking these approaches. And in one of the interesting University of Aberdeen study, the authors Nadisha Piyaratne, they have identified diagnostic salivary biomarkers in oral cancer and again in OPMD and their relation to risk factors. All of us know there are certain risk factors which increase the chance of developing oral cancers. For example, in oral cancer, tobacco use, whether it is smoking, chewing, alcohol use, poor oral hygiene, all these factors influence. These are known as risk factors, and they increase the likelihood of an individual's chances of getting or developing oral cancer. So these authors attempted to study what is the likelihood of these biomarkers and risk factors association. And they have found, interestingly, certain interleukin-related markers are associated with risk factors. So with that background, I hope you all got a picture how interesting the world of biomarkers is evolving, emerging on a real-time basis. It is not stationary or permanent. Every day, researchers are finding new angles and new biomarkers to help us understand how we can tackle these oral cancers from multiple angles. Now, I will lead you into this world of innovation. Once you identify these biomarkers in an individual or in the system, how we can translate it into a product of innovation so that we can use this product to detect that biomarkers. So as I already told you, liquid biopsy market is likely to propel because this is the future and this is where the entire revenue is concentrated with $4.1 billion in the next few years because a lot of governments and companies are focusing their entire R&D efforts in this area. And if you look at the entire market growth for the next 5 years, it is almost like 48 billion for the entire biomarkers. But when it comes to oral cancer related biomarkers, it is almost $7.3 billion. And as you can see, the Asia Pacific market is huge, around 18%, because all of us may be aware that though there are 1.1 billion tobacco smokers and equally number of chewers, 80% are situated in low and middle income countries, including Asia Pacific. And if you look at the progress of head and neck cancers, it is growing at a rate of 23%. So we have to interlink all these numbers and understand why the market is growing at such a rate. And if you look at the in vitro diagnostics market, again, from 2021 to 2030, you can see the translation from $91.6 billion to almost $130 billion. And depending on the type of test, whether it is lab test, genetic test, or imaging, endoscopy, or biopsy, the market is growing. And it is more, third biggest market player is again Asia Pacific. And by application, where is it happening? You can see oncology or cancer is the third rank. And again, Asia Pacific is third rank. And if you look at where the end users are for this in vitro diagnostics, laboratories, hospitals, academia because of our research, and then comes the point of care testing. And if you look at who are the key players right now for in vitro diagnostics based on biomarkers or liquid biopsies, Roche, Danaher, Abbott, and Siemens. These are the major players in this market segmentation analysis so that we understand how innovation is escalating because of these big players. And here I would like to introduce you to our own Indian origin author, Siddharth Mukherjee, and his latest book, The Song of Cell, An Exploration of Medicine and the New Human. Please, I recommend all of you to go through this book. Very fascinating book, which I have started just 2 days back when I was in Philippines. And I'm just going through the book. I'm in 56 page. Very fascinating. And he talks about the current cellular therapies, how at cellular level we are able to derive therapies for these cancers. And Siddharth Mukherjee, incidentally, is turned up to be an entrepreneur. He's an oncologist, but his latest role is he also started a joint startup with Indian-based, Mumbai-based Kiran Mazumdar Shah company. They have raised $15 million for their venture where they are doing CAR T-cell therapies, and he's going to be in Bangalore in January, and we can expect some kind of robust attention being given to this industry because of star celebrities and oncologists investing themselves as entrepreneurs directly into the industry. And if you look at the lateral flow assays, when I say liquid assay and lateral flow assay point of care device, this is how it actually manifests when it comes to reality. A majority of us might have been coming into contact with this lateral flow assay kits during COVID era. This is how a point of care device for even oral cancer looks like. It quantifies the body fluids, and selective biomarkers will be coded so that they can be easily detected at point of care and later can be confirmed through gold standard, that is biopsy. And when we looked at the literature again, in this latest study from 2021, ultra-sensitive and highly specific lateral flow assays for point-of-care diagnosis, lots and lots new technologies have been adopted and upgraded so that we get more sensitive and more specific LFA kits so that we can diagnose the individuals with a lot of certainty, in which they have identified high affinity molecules and novel highly specific molecules, especially with CRISPR-Cas technology, and also the recommended assay optimization so that any non-specific binding and false positive, false negative results can be minimized. And this is the picture of all these steps. This is the typical LFA flow diagram where you have a sample pad where the salivary sample like bubble can be added with the dotted, probably having the biomarkers. And it goes through this flow through the conjugate pad and arrives at these two strips, both a test strip and a control strip. And if at all the biomarkers are presented in that particular sample, they will be captured here and you'll get the test result. This is a typical flow diagram, but the latest technology is helping us to enhance the samples through enrichment procedures, through pre-concentration and pre-amplification steps. And there, we also have one more step called assay optimization so that the assays become more and more perfect using certain affinity molecules like nanobodies, aptamers, CRISPR-Cas coated bodies, so that the assay optimization is the key here so that we prevent the false positives and false negatives so that we don't scare someone not having cancer to be cancerous, as well as missing someone who is already having cancer with the false promise that he's not having cancer. And finally, the signal amplification procedures so that there are a lot of new technologies coming here with fluorescence, Raman scattering, magnetic, thermal, electrochemical sensors, etc. A lot of novel technologies are coming. This is just to introduce you and a peep into this world, not to dazzle you with the in-depth information, because experts will be coming in later webinars who will really dazzle you with their world and with their expertise. I'm just introducing you today into this world. And in this particular study, which came out in September 2022, very, very recent, the simple diagnosis of cancer, especially the oral cancer, they attempted using CEA and Cypher 21-1 in saliva using electronic sensors. Last month, we were in SRM attending one conference where the professors there talked about electronic sensors and potential. So similar display of this circuit they have done. And one way of early diagnosis of cancer is by detecting biomarkers, as we already were talking for long. And in this particular study, they have used these two biomarkers, and using this particular circuit with portable rapid electronic biosensors and their quantitative measurement at this particular level, they have developed a portable prototype, and they said they could accurately discriminate between 9 cancer patients and 5 healthy controls. So this is how a prototype gets developed in a lab with small samples. And as I have shown you the life cycle, now it will move to the real world uncontrolled setting where you have to replicate this experiment in hundreds of patients, in hundreds of varieties of groups of patients, and then go through the entire cycle where finally you land up with the clinical utility. And also, I would like to leave you this session with a very heartwarming news. Recently, our own professor from Ahmedabad, he have discovered a novel microRNA in saliva, which is going to predict the tumor aggressiveness. Thereby, we can have a prognostic view of the oral cancer. This is again happening in our country, in our own labs on a daily basis. As I said, as and when we are talking in the seminar itself, lots and lots of changes are happening in oral cancer early diagnosis. And I hope through this webinar, all of you actually got an idea how things are being attempted to change, because in the last 10 years, nothing has changed in the sense like the numbers have increased, but the death rates have not come down, and economic productivity, quality of life is still the same when people are coming to the clinics at stage 3 and 4. And in this last few years, we are seeing some kind of attempts being made in the area of innovation through this biomarkers precision. But I want to remind you that it is a long way, because it has to go through an entire cycle of validation, replication, and licensing, and post-market entry. We have to still follow it up for public health impact and all that. So it is a long cycle. So we have to be mindful of that. But in spite of that, factors like low cost, easy processing, and instant results are expected to drive the growth and innovation of salivary biomarker-based detection kits for this particular reason. And various companies and universities are trying to develop the rapid detection technology for oral cancer kits so that we can detect oral cancer in early stages and prevent the variety of loss of life as well as quality of life for our population as well as global population. And these are all the references, and I'm happy to take any questions. Thank you so much for your patient hearing.